Now I will be inspecting your ears and hearing. So before that, I'm going to ask you some questions. Is that okay?
Okay.
Do you have any family history of hearing difficulties or hearing loss?
No.
How about recent ear problems or medical history?
Yes. Swimmer's ear.
Swimmer's ear, okay. So now, I'm going to complete your auricles. Is that okay with you? Okay. So as I can see, your ears are aligned with the outer contour of your eyes. It is firm and not tender. Now for your outer ears, as I can see, there are no presence of pus, blood, or any type of obstruction, as well as of the other ear. So now I'm going to inspect your tympanic membrane. I'm going to use an otoscope inside your ears. Is that okay with you? As I can see, your inside your tympanic membrane is grayish in color, is moist, and I see presence of serum or wax, which is normal, and I don't see any abnormalities or any lesions. Now we're gonna perform the Weber test on you, okay? So I'm gonna use a tuning fork and tell me whether you hear the vibration sounds on the left or on the right or in the middle, okay?
Okay.
So where do you hear it?
Middle.
Okay, thank you. Next, we're going to perform the Rhines test. You will hear a buzzing sound here, okay? So I'll use a tuning fork and tell me where you hear it the most, okay? So, where do you hear it?
Side ear.
Okay, thank you so much. So now we're going to perform the Romber's test. Please stand up, sir, and raise both of your hands forward, and close your eyes. And I will support your back in case you fall, okay? Now I'm going to assess your nose and sinuses. Before that, I'm going to ask you some questions. Is that okay with you?
Okay.
Do you have any allergies, change of smell, or nosebleed before?
No.
How about do you find difficult in breathing?
No.
Now I'm going to palpate your nose. Is that okay with you?
Okay.
So as I can see, your nose shape is symmetrical and the color is suitable to your face. And I don't see any flaring on your nose, and I don't feel any tenderness on your nose or any dislocated bones or cartilages, which is good and normal. So now we're going to test your patency in your nose. Please close your mouth and put one finger on your nose, on your right nose, and then breathe out. On your other nose, please. Breathe out. Okay. So as I can see, you have no difficulty in breathing in and breathing out on both of your nose. Now I will be inspecting your nasal cavity. Can you please close your mouth and tilt your head up? Okay. So as I can see, there are no redness or swelling or any discharge on your nasal cavity, which is good. For next, I will be palpating your maxillary and frontal sinuses. Tell me whether you feel any pain or no, okay? So, do you feel any pain?
No.
No? Okay, how about here?
No.
Okay, thank you. So now, I will be assessing your mouth and oropharynx. Before that, I'm going to ask you some questions, okay?
Okay.
When was the last time you visited your dentist?
A year ago.
How about do you feel any dental problems on your teeth?
No.
Okay, thank you. So, can you purse your lips for me, please? So, as I can see, your lips are symmetrical to each other. It is pinkish in color and not dry, and it is moist. Now, for your inner lips, I'm going to pull it down. Is it okay?
Okay.
As I see, it is shiny, moist, and pinkish in color. For your teeth, it is pearly white and you have a fixed position in your teeth, and it is in 32 pieces. For your gums, as I see, it is pink and moist, and I don't see any gum disease or any lesions on your mouth, which is good. Can you stick your tongue out, please? So as I can see, it is pinkish in color. It is moist, and I don't see any crack, which is good and normal. And now, can you please move your tongue upward, downward, side to side? Okay, thank you for that. Can you please put the tip of your tongue against the roof of your mouth?
Okay.
So as I can see, your frenulum is at the center. It is pink and moisture, which is good and normal. I don't see any lesions or any obstruction. Thank you. So now I will be inspecting your palate. Can you please open your mouth, as I will use my tongue depressor to see clearly.
Okay.
Open your mouth, please. So as I can see, your hard palate is pale and dome in shape, and your soft palate is spongy, pink, and moist, which is good and normal. Can you say ah? So as I can see, your uvula is vibrating, and it is on the center, which is good and normal, and I don't see any obstruction inside your mouth. Thank you so much. Now, I'm going to assess your neck. Is that okay with you? Before that, I'm going to ask you some questions. Do you have any history of headache, stiff neck, or injuries on your neck?
No.
Do you have neck lump or thyroid problem? Okay, thank you. Now, please stay in that position. So, as I can see, there are no any abnormal swelling on your neck, which is good and normal. Now please move your head towards your chin and tell me whether you feel any pain, okay? And now go back. And then look at your right. Left. Do you feel any pain?
No.
So next, please look at your right and resist my hand, okay? Okay, on the other hand, on the other head. Okay, thank you for that. So next, please shrug at my resistance, okay, on your shoulder. Okay, so as I can see, your head movement, your muscle strength is good and normal. They can resist my strength. Now I'm going to assess your lymph nodes. Now I'm going to assess your lymph nodes. Is that okay with you? I will be palpating it, okay? So tell me whether you feel anything.
Okay.
So as I can feel, there are no any tenderness on his lip. Now I will be palpating your trachea. Is that okay with you?
Okay.
For physical examination, I'm just going to state the result, okay? So for your skin, hair, nails, skull, face, eyes, and vision, visual acuity is normal, as well as the ears, hearing, nose and sinuses, mouth and oropharynx, and neck. Overall, it is good, and whenever you need help, just press the bell button or just call me out at the nurse station, okay? Have a nice day, sir.